There was a lot going on in the last month of my final year at Yale Medical School. My thesis was accepted, and actually it got published later on. The subject area was cancer of the breast, the use of depo-testosterone in advanced stages. The other big pressure, of course, was preparing for and taking the national boards, Part 2. The graduation preparations and ceremonies were pretty wonderful. I remember both my parents and my wife's parents came. I think Janet, my sister, came as well. Yeah, I think she was, she may have been married. At any rate, I remember her questioned husband was there and took a number of photographs for us from the balcony of the room in the library where we received our MD degrees. Most of us promptly obtained MD plates for our cars. This was something that was considerable status at that time, but very shortly thereafter there was a social attitude that changed, and we changed our plates back to ordinary plates. There was no real advantage. You couldn't double park. And there may have been a disadvantage in being too easily identified by negative elements. In the part of town that we lived in New Haven, about that time, I was wrapping up my U.S. Air Force Medical Corps commission as a first lieutenant and arranging for my orders. This would pay for moving furniture and the trip, which I think was anchored in my wife's parents' home address in New Hampshire. And from there down to Chapel Hill, North Carolina, where I had my first year of surgery residency. It was called the first year of surgical residency, suggesting that we had skipped our intern year, or maybe it was more of a straight surgical internship. But we discovered when we arrived there that we were still at the bottom of the heap, because the interns did not go on inpatient surgery duty. They were only in the clinics and didn't have a whole lot of responsibility, whereas we did. Along with that, we were also the summertime phlebotomists until the medical students returned. This required an early morning start to obtain the blood specimens from all the patients on our ward. The duty was quite heavy once it started. We arranged to arrive there about a week early, and got into some nice housing and had some time to travel out to the Smoky Mountains, which we discovered was about 4 hours away. It was a pleasant introduction, and then came the crunch. The workload was heavy because there were 8 of us first-year residents to cover 12 different services. The first service I was on was urology, and I enjoyed the chief and the staff and the whole attitude, which was so much more relaxed, even with a heavy load. There was a lot of joke telling, and there were gatherings at the professor's home, and the quality of surgery was much more of a surgical nature than at Yale, where urology was still pretty much a blunt surgery procedure, where it was a very precise techniques taught at this North Carolina program. I think this early exposure may well have had a strong influence on my choosing urology as my specialty. I was still programmed for a 5-year general surgery residency at that time, but eventually, as the year went by, I made a decision to specialize. It just didn't make sense to have all that specialty surgical training and wind up in a general surgery practice. And so I discussed this with my professor, and he was not too pleased. But then we learned that the urology program had still not been fully approved by the American Board of Urology, whereas general surgery was by their specialty board. Though there was considerable pressure on me to make a decision toward the end of that year. Excuse me. And I did decide to go with the urology specialization, and this meant that I would have to move to another hospital. I'll come back to that. During the year, as I noted, the duty was pretty heavy, and 2 out of the 8 of us actually dropped out. One, I think he just quit. The other one had a nervous breakdown, and the 6 remaining said, how do we arrange to have a nervous breakdown? That seemed like a great idea. The housing, as I noted, was very nice, though it wasn't there very much, as our duty was 24 hours a day, every day of the week, and we did have a 2-week vacation. My wife was working in physical therapy in Durham, North Carolina, about 12 miles north. She had started out at Duke Hospital, but there was some difficulty between herself and her boss, and she transferred to another hospital and was comfortable there. She worked there the entire year because I certainly didn't need the car. I remember getting home for a few hours on a weekend and discovering that a fellow classmate of mine from Yale was in internal medicine residency there, and he had only every other night on call. And I remember teasing him and saying, "Don't ever complain if I'm making more money than you do as a surgeon versus an internal medicine man." We suffer for it. I have stayed in touch with him through the years, and actually have discovered he's bought a place here in Naples and winters here as well. At any rate, during that year, we became pregnant, and my upper resident said to me, "You went home." And this was the attitude, even though it was joking. The oncoming increase in our family qualified us for a move to a larger unit in the housing. And about that time was when we made this decision to specialize and leave the general surgery program at that center. And the Air Force said that I had to have a 5-year program, not a 6-year program. And the Board of Urology only required 5 years. I mention this because some centers were adding a year of research to their programs. At any rate, I got down to Pope Air Force Base and got my Air Force uniforms and my lieutenant bars, and proceeded to an Air Force teaching hospital in Wichita Falls, Texas. In the process of the move, there were a couple of weeks free, so we made a quick visit to New England to visit with families, and then on to Texas. We got a motel while we waited for on-base housing, and that first week was in the refinery area, and we wrote home that we had to wake up oily in the morning. We thought we were pretty clever, but it did permeate the air and our clothing. There was a sense that we were really in Texas. I was a second-year general surgery resident in this program, but recognizing that I was going into urology, the hospital commander and the chief of urology made certain that I got to scrub on all the major urology procedures. And as the year went by, I even began to do some of these with the professor at hand as my assistant. So this was a added experience in urological surgery. The next decision was where would I get my specialty years, which would be 3 more in a board-certified urology center. The Air Force had one in Lackland Air Force Base, a 2,000-bed hospital, where my uncle was the executive officer, which is the second in command of the hospital. The commanders were always MDs. He was not. The opinion, when I went down there to visit, and also to the Army teaching hospital in San Antonio, was that perhaps these were not quite as fine a program as would be available in university-centered hospitals. And I think I have to acknowledge my Uncle Bob's strong advice in that regard, that with my background, he felt I should take the civilian university residency and pay back an extra year to the Air Force rather than the straight military residency. And that's what I did, applying to UCLA, which had a 3-hospital program. But back to Texas, this was the year that Greg arrived, Greg 3 that is, and this was a very happy time. The delivery was a little slower than expected, I guess, number one, and to Dot's annoyance, they gave her medication that dulled the pain so much that she was not fully aware of the process. And her negative attitude toward medical care seemed to begin at this point. Post-delivery, she had some form of breast problems. She had wanted to breastfeed, but either the natural process of caking or the like was interpreted as an infection, and she was not allowed to breastfeed. And that first day home, when this was decided, I had to rush out and get all the equipment for making formula for Greg, and got home and prepared it, and by then he was pretty hungry, but very satisfied with the formula. And through the next week or two, I took light duty and pretty much cared for both my wife and my new son. There was always a lot of help around, the neighbors, and even the hospital personnel. And we got through that phase and had a very pleasant year. The Officers Club was the center of social activities, and I think this was where I had my first alcoholic drink. And I didn't like it, and that was the end of that. The club was fun, and there was only a moderate amount of pressure for drinking, so we were able to slip through that. And we had a number of friends in the immediate neighborhood. One couple and the 3 of us went to Carlsbad Cavern when Reg 3 was probably only 6 months old. We put him in a cardboard box in the back seat and took him into restaurants with us with a baby blanket over the cardboard box. And during the meal, he started bumping his head up at the blanket, and all the other folks in the small restaurant were enchanted with this baby who was so good. The trip was fun, the company was great, and we stayed in touch with this couple when he went to some specialty training in oral surgery at UCLA when I was there the following year. Now, the UCLA program had 3 hospitals: the large county hospital in the southern part of the city, a large VA hospital up near the university, and the university hospital, which was really fairly small. There were only 12 beds, as I recall, and that the resident rotating through the university hospital had for patient load, whereas the VA and the county were huge, with at least one 30 to 40 bed ward. The rotation started for me at the county hospital, where I was again the bottom man on the totem pole, and I was somewhat frustrated by not getting to do more surgery because of the hierarchy above me not passing things down. And I guess I had been spoiled by having that year at a teaching hospital in the Air Force, where I was doing a good deal of surgical procedures. Well, I suffered through about 6 months of that, and then was rotated to the VA hospital, where the primary exposure was going to be learning transurethral resections of the prostate and bladder tumors. The experience was phenomenal. By the time I had finished a year there, I had done more of these procedures than any other residency program I'm aware of. Then I rotated back to the county hospital, where I was preparing to become the chief resident in my 3rd and final year. I didn't rotate as an attending or resident in the university component, but attended their rounds and weekly conferences. The VA period was the beginning of some research that I did on what was hoped to be a new diagnostic lab test, the prostatic fraction of acid phosphatase, for diagnosing and monitoring cancer of the prostate. This was of some interest because I was interested in the clinical research, not the basic work with mice and rats, which would have added another year, which I didn't have. But after I published my work and offered it to the American Urological Association Western Section. I was delighted to have their outside approval, and I won the research award that year that I finished my residency. The Surgeon General was especially pleased and wrote me a personal letter of congratulations and arranged for me to have what was called temporary duty, or TDY, orders to move me and my family up to Vancouver in British Columbia, where the western section of the AUA was meeting that year, in order to present my paper at that meeting. This was quite a pleasant experience and a great way to wrap up my specialty years of training. Then my orders were to report to Homestead Air Force Base Hospital. So we crossed country to New England and visited family, and then on down to Homestead. The position was as chief of urology in a relatively small hospital, where I was also appointed the director of the outpatient department. And I soon recognized that one's administrative abilities were more important to the Air Force than your surgical talents. But we had a good commander. I think his name was Paul Stavik. And he allowed me and encouraged me to attend the rounds at the University of Miami Urology program, some half-hour drive away, on a once-a-week basis. This, as I've noted earlier, allowed me to visit my parents, who were then living in Miami. It also was good preparation for the specialty board that would come in later years, and allowed me to make good contacts with civilian urologists. Actually, there was an opportunity to join a urology practice in that community when the residency payback time was over. The other people that I remember from the Homestead Hospital were Tom Lee, was a captain. He was chief of surgery. And Major Murphy Chesney was the deputy commander. Interestingly, he stayed in the military and eventually became a Surgeon General. I know this because of another co-worker, a young captain, Jim Silver, who was acting as a pediatric assistant at the time, and we became good friends, working across the hall from each other, and he became an important part of my sailing crew. I'll take that up in another category. The general experience was very favorable, and the camaraderie was really great. The commander was a golfer, and we had a golf course right on base. So those of us who played golf would join him in the mid-afternoon about once a week for a round of golf, leaving the care of the hospital in other hands. But we were right across the street, so we were all immediately available. While we were there, there was a hurricane that flooded all of the Homestead area and came within a few inches of requiring our evacuation. Down the street from us, the folks in those homes, which were duplexes with carports in between, they had to be evacuated. The experience was good until there was some kind of a recall or reactivation of the reserves. And this brought into our base a goodly number of Miami practicing physicians who were in the reserve but had never expected to be called up, and so were very upset and negative in their response to the military duty. They were still trying to wrap up their practices, and so often were not on the base when they should have been. And this became a disciplinary problem for the commander, who was outranked by the reserve commander, who was more lenient with his own troops. And because of this, there was a change of command. And things changed dramatically. We became a very rigid operation. And everyone had to sign in and sign out every time they went anywhere, even though we regular officers had never had these problems before. I should mention the difference between a reserve officer and a regular officer. I had signed up originally for the 1-year internship year as a lieutenant and was due to pay back 3 years of military duty. Since this was the time of the doctor draft, where a 2-year service was required, this was really only a 1-for-1 payback, but would have taken me an additional 3 years. And when I signed up for the full residency with a total of 5 years, I applied for and was approved for a regular commission that went along with that program. This 5 years of civilian residency, during which I was first a lieutenant and then a captain, required a payback of 6 years. And as a regular officer, there was an expectation that you would probably stay on for a full career of 20 plus years. When reserve officers were on duty, they had a tour of duty with a time that they would be discharged unless there was some national emergency, whereas the regular officers had to request release or discharge. My own experience was generally favorable, and when my good work and all was recognized by the superior officers, they found that there was an overload of captains, and I was not going to be a candidate for promotion to major, as had been promised to me by the Surgeon General's office. To make up for this, I was sent out to flight medical school, which was to prepare you to be a flight medical officer or a flight surgeon. The difference being that a flight surgeon was paid an additional amount of money and had to spend a certain number of hours flying with the pilots of his base each month, whereas the flight medical officer was more a standby, ready to do this duty as necessary, but this allowed for total focus on your medical specialty and the care of patients. One interesting thing was the patient load was as balanced as any other community because of the dependents and the children. So my experience was not limited to healthy young males, and was a balanced experience throughout my military payback years. I mentioned the Flight Medical Officer Training School. This was in San Antonio, and I was given temporary duty orders for this and sent out there alone. My wife and 2 boys at that time, since court had arrived during my residency at UCLA. They stayed in the homestead housing through this period, and it was a very interesting exposure to aerospace medicine. During a 13-week program, there was another upheaval, and that was the Cuban crisis. And I recall having contact with some superior officers who had some insight into what was happening, and they advised that I call my family in Homestead and have them evacuate immediately to New England. And this is what I advised. I told Dot to take whatever was immediately necessary and proceed to her family's place in New Hampshire, and to take the internal mountain roads and not the East Coast Highway, because this was expected to be full of military vehicles. This she did, taking the 2 boys, a dog and a cat, and saying goodbye to my parents who were in Miami and insisted on staying there. Dot traveled the back roads, which allowed her to shed the cat on the highway, but kept the dog until they were in Candia, New Hampshire. I gather this was a somewhat difficult time for them, as I had another few weeks, and the Cuban crisis, of course, built the tension as well. My parents told me that every vacant lot in Dade County was full of heavy military equipment. Trucks, tanks, artillery, monster trucks, and lots of things covered with tarps to obscure their identification. I didn't see any of this, but we were told we were probably no safer in San Antonio from the missiles that were being placed in Cuba by the Russians, and perhaps New Hampshire would escape their targeting. Well, as history has shown us, that was resolved between President Kennedy and Khrushchev, and the crisis was averted. So the next move was to bring my family back from New Hampshire to Homestead, as I was due to move back as well. The tension level was drastically reduced, but there was an added factor. While I was still in the flight school, there was an occasion of an opening in Wiesbaden, Germany. This was of interest because it was a position in charge of the entire urology programs in the teaching hospital there in Wiesbaden, but also a second hat under the Surgeon General's office, where you were the chief consultant in urology for the entire USAFE hospital program, which included England, Europe, the Middle East, and North Africa. The circumstances that opened this were peculiar in that the colonel who was holding this position had his son back in the States who was running track and died on the track, and out of consideration for him, he was transferred back to the United States, leaving this opening. Perhaps my research award and recent graduation from the Flight Medical Training Program in aerospace medicine helped to have me move into consideration, and I was appointed to this colonel's job, still having only a captain's rank. My brother-in-law, that is my wife's brother, was an Air Force pilot who was also in this same base already, and assured us that he could arrange housing for us and we could all come over together. As the time came, this fell through, however, and I had to proceed without my family and arrange my own housing once I arrived. This produced a couple of months delay, and this strain of being moved from Homestead and flown over Greenland with a stop there, and then on into Frankfurt Army Base and to Wiesbaden. I don't recall all the details, but I'm sure this was somewhat stressful for my wife. And the boys were in first and second grade, and they adjusted quite well, except for Greg, the older, in his reading abilities. We considered holding him back a year, but that would have placed him in the same class as his brother. So we opted for tutoring, and this was effective. And he closed the gap and did very well thereafter.